Now try to quickly define another terminology which will always come across it as far as chemical pathology is concerned. We're trying to look at the terminology before we go in. So this is what is known as the GFR. So GFR is a very common terminology in chemical pathology. So we'll try to, tackle it. So GFR just has to do with the glomerulus, all right? So how much of urine is a glomerulus making? So if you are able to know the GFR, you can be able to know if somebody has issues with the kidney or if their kidneys are functioning well, you know. So the key measure of how well the kidneys are working, okay? Glomerular filtration rate, how much of fluid is able to get into here, how much of it is being able to be sorted, then waste products passing through to be excreted, okay? So of course, if the kidneys are not fine, it will not be going on as smoothly as I'm talking. So it estimates how much blood is passing through the glomeruli and how much of it actually gets filtered out of urine and excreted. So it's the volume of fluid filtered from the kidney's glomerular capillaries into the tubules per minute and unit time. So normal range should be about 90 to 120 mils per minute per 1.73 meter square in healthy adults. So it's expressed as what? Millimeters per minute per 1.73 meter square of body surface area. So how is it measured? It's calculated using body creatinine levels. They also make use of your age, your sex, and also sometimes your race. So that's basically it. They are trying to say, because if your kidneys are functioning well at all, your creatinine should be cleared very, very, well. So they always measure the creatinine levels in the body. If it's high, there's a problem, it's a query. Do you understand? So that's what we got. So functions and importance is it helps you to now know how the kidneys are functioning. It helps you to diagnose that somebody has a kidney disease. And as you are treating a patient of kidney disease, you still be measuring the glomerular filtration rate. This will now be if it is improving. Do you understand? You now give you an idea that okay, this patient is improving. If it's getting bad, you now give you an idea that okay, this patient is getting worse. So high glomerular filtration rate, it should be normal. If it is too high, it shows you that the kidney is losing too much water, which is still not good. Hyperfiltration leads to dehydration. If it is too low, it shows you that the kidney is not working very well. Then also, you can use the different glomerular filtration rates to now be able to stage at what level the kidney damage is. Okay, so these are just overviews where we go in very well. You guys will get to understand this concept better.